Disclaimer. The views, opinions, and content expressed in this video are strictly for educational purposes. Aspects of this video are not to imitate the lives of substance users, but rather to enhance knowledge on pharmacological properties.
Juppie is a 22-year-old woman visiting an OB because she suspects that she is pregnant. She completed an at-home pregnancy test which came back positive. Dr. Amin greets Juppie and her partner Navi and orders a blood test for further information. After receiving the results, Juppie shares her concerns about having a current substance abuse problem and the importance of keeping her baby. Dr. Amin explains that there are options available for Juppie.
Methadone is a medication used to treat addiction. It is recommended as a treatment of choice for pregnant women who have an addiction to opioids. Methadone is a medication that can be safely used during pregnancy and for anyone else trying to recover from substance abuse. With a stable dose of methadone, pregnant women can have a normal pregnancy and delivery.
The generic name of this medication is Methadone. The trade names include Dolafine, Metadol, and Methadose. The therapeutic classification is opioid analgesic. The pharmacological classification is opioid agonist. Medications for the patient include moderate to severe chronic pain in opioid-tolerant patients requiring use of daily, around-the-clock, long-term opioid treatment, and for which alternative treatment options are inadequate. Also, for detox and maintenance therapy for opioid use disorders, and unlabeled use is neonatal abstinence syndrome. The pharmacokinetics of this medication include well absorbed from all sites, 50% absorption following oral administration. It is widely distributed, crosses the placenta and enters the breast milk. Protein binding is high, and it is mostly metabolized by the liver. Some metabolites are active and may accumulate with chronic administration. The half-life of this medication is 15 to 25 hours, increased with chronic use. The PO route has an onset of 30 to 60 minutes, peaks 90 to 120 minutes, and has a duration of 4 to 12 hours. IM subcutaneous route. It has an onset of 10 to 20 minutes, peaks at 60 to 120 minutes, and duration of 4 to 6 hours. The doctor explains that if Juppie wants to continue with the pregnancy, there are treatment options available for her to help with her existing opioid addiction. After hearing the doctor's advice, Juppie decides that this is a good fit for her.
The action of this medication includes binding to opioid receptors in the central nervous system. Methadone works to treat pain by altering the perception of and response to painful stimuli, while also producing generalized central nervous depression. The therapeutic effects include decrease in severity of pain, suppression of withdrawal symptoms during detoxification and maintenance from heroin and other opioids. The desired outcomes include decrease in severity of pain without a significant alteration in level of consciousness or respiratory status, and prevention of withdrawal symptoms in detoxification from heroin and other opioid analgesics. The common side effects and adverse effects of methadone include confusion, sedation, dizziness, dysphoria, euphoria, floating feeling, hallucinations, headache, unusual dreams, blurred vision, diplopia, meiosis, respiratory depression, torsades de pointe, hypotension, brachycardia, QT interval prolongation, adrenal insufficiency, constipation, nausea, vomiting, urinary retention, flushing, sweating, physical dependence, psychological dependence, and tolerance.
When taking methadone, ask your health provider how and when to ask for pain medication. Take methadone exactly as directed. If the dose is less effective, do not increase the dose without consulting a healthcare professional. Methadone may cause drowsiness or dizziness. Avoid driving or other activities requiring alertness until response to medication is known. Be aware of the potential for arrhythmias and the importance of regular ECGs. Methadone has a prolonged action, causing increased risk of overdose. Signs of overdose include difficulty or shallow breathing, extreme tiredness or sleepiness, blurred vision, inability to think, talk, or walk normally, and feelings of fainting, dizziness, or confusion. Avoid concurrent use of alcohol or other CNS depressants. Make sure to turn, cough, and breathe deeply every 2 hours to prevent atelectasis. Tell a healthcare professional what medications they are taking and to avoid new medications, over-the-counter, vitamins, or herbal products without consulting a healthcare professional.
Methadone does not create the same euphoric effects as heroin or morphine because it is designed to do the opposite. The drug is formulated to block the pleasurable sensations of other opiates. While methadone is used as a way to curb addiction and reduce cravings, it is a heavily regulated drug. It is so regulated that patients who are prescribed methadone in an outpatient setting have to go to a clinic every day to be administered their dose. It is a powerful opiate with potentially addictive qualities.